All right, so the face numbness, Bell's palsy has been going on for about 4 weeks, correct?
A couple weeks.
All right. Also getting some neck pain.
I've had chronic neck pain
Yeah.
for what, four years?
And then
More than that, sorry.
and then the hands are tingling as well.
Mm-hmm. Always left, sometimes right. Or always right, sometimes left.
Okay. And then can you remove your mask? I just want to see.
Sure, looking at me normally can't see it, but when I do like a facial expression. Like,
okay, yeah. And then when you touch it, can you feel?
yeah, my feeling is all there.
It's just the muscles don't want to contract when you smile.
And it's like, so, like if I were to try and like squint my eyes closed, like I can open the left one like real easy. I don't have the muscle tone. And it's the same thing with like my mouth. Like if I wanted to swish water, it just shoots out the left side.
The left side, okay. All right. Okay, so with Jenna, the biggest issue is this yellow line right here, kicked way up on the left, down on the right. So we've got to get that more centered while getting the head and neck. Get this more level, while getting the head and neck centered. So we're going to adjust her. We're going to go 2.5 inches high and 2 1/4 anterior on the left, and we'll post x-ray her and see how she responds. Okay, so looking at the leg length, you can see the left is contracted about 1/4, 3/8 of an inch short on the left, and you can feel it when you palpate the quad as well and the IT band. So when we fix the alignment, that will clear. Have you sit up for me? We'll do a little more. And on your back. Okay. Might be a little lightheaded too. Okay, so after the adjustment, you can see legs nice and balanced. The legs, are much more relaxed. Okay, so we got a really nice correction with Jenna. So you can see over here on the left, this line kicked way, way up. And then coming over here on the right, after the adjustment, you can see that line almost perfectly level. Huge reduction in the numbers, head and neck pretty darn centered. So we're going to leave her like this. Her body's in alignment. There's no tension. And we'll check her in a few days a week, and then we'll see how she's doing. All right, so it's been about 2 weeks since we did Jenna's initial correction. And how's everything been going?
Things have been going good. My migraines have subsided several times a week to barely anything at all other than maybe a mild headache. So
awesome.
That's been nice. The nerve pain in my neck is subsided for now. I still have a little tingling, but that's totally manageable. And as for the Bell's palsy case that I have, I feel like I regained almost all my function other than a little bit of twitching in the eye.
Awesome.
So that's wonderful.
Oh, look at your smile. It looks totally normal.
Back, yeah.
Yes, awesome. Oh, that's wonderful. Awesome.